This man, Ted Bricker, and his fellow co-workers at a place called Occidental Chemical Plant in Lathrop, California, were discussing the fact that none of their wives was having children. And medical tests confirmed their fears. They were all sterile. Men were working with something called DBCP.
In 1977, at a pesticide plant near Stockton, California, workers exposed to the poisonous chemical DBCP, dibromochloropropane, became sterile. This shocking story made headlines. These workers' wives were unable to conceive children. Then Governor Jerry Brown called for hearings that eventually led to legislation that soon resulted in the creation of the Center for Occupational and Environmental Health. An occupational health center evolved out of this chemical exposure episode. To help prevent future problems like the DBCP scandal, legislation mandated a three-pronged approach by the University of California: teaching, research, and public service. As the center grew, it soon broadened to include both occupational and environmental health.
I got a call, a random call came in on the telephone, and this guy introduced him to me as the chief medical officer for something called Hooker Chemical. Rumors were that some of these families were trying to have children and that they had not been able to do so. Some toxicological reports of infertility in animal species associated with this particular chemical that we had chosen to look at out there because we'd never heard of it. And that was what became the notorious DBCP, dibromochloropropane. Our colleague Don Horton, Don was a physician who at the time was the head of LOHP. And I didn't know him well, but I knew him. And he was consulting with the Oil, Chemical, and Atomic Workers Union, who represented the workers out at that plant. And so once we figured out that he was talking to the workers and we were talking to the company, we talked with each other in the back room. It transpired that the man who at that time was the director of the California Department of Industrial Relations was a guy named Don Weil. And Don had actually been an employee of the university prior to taking this job. Don had the idea of what became the COEHs, that there should be, and he was responsible for the drafting of the legislation on behalf of the Brown administration. Jerry Brown was in his first term as governor at that time, and it mandated the creation within the university of two occupational health centers, one in the north and one in the south, that they should involve medicine and nursing programs as they related to occupation, toxicology, epidemiology, and industrial hygiene were the 5 mandated areas.
We're fortunate to have top flight faculty in all areas of occupational environmental health. For example, in toxicology, Martin Smith and Steve Rappaport are in the forefront of a new area called exposure biology, where they're using sensor technology and high throughput array technology to better assess exposures to multiple agents at one time over a longer period of time than has been previously been available. Green chemistry is another area where there's new research trying to come up with materials that are less toxic both to the environment and human health. With regard to indoor air pollution from domestic cooking around the world, Kirk Smith and his colleagues have led the way to the testing of new stoves that are cleaner and that therefore will cause less disease for women and children around the world. 50% of the world's population still cooks with solid fuels, so it's very important that we develop these and distribute these stoves, and Kirk is, again, leading the way in this regard. Another area where I think the COEH is doing really good research at the present time is in the area of environmental health disparities. It's often the most disadvantaged individuals that have the highest exposures in our society, and Rachel Morello-Franche, Amy Kyle, Mike Jarrett have been working hard to better understand the interplay between the susceptibility of and vulnerability of such populations with regard to the effects of various environmental pollutant exposures. COEH is not just about education and research, we're also about public service. And I'm very proud of multiple COEH faculty members that serve on public agencies and have helped to improve regulation both on the occupational side and the environmental side.
We have about 200 firefighters from San Francisco area participated in this intervention program. The Station 7, we were told that it is the most busy station, and as you can imagine, most exposures are worse than other stations. So we went to Station 7 with Patty Quinlan and my doctoral student Stephanie to do some noise measurement, and also ask them to participate in internet-based intervention. So the goal of the SIREN program is to reduce hearing loss problem among firefighters.
The United Auto Workers Union worked with their management at the NUMMI plant. This was a joint GM-Toyota administered automobile assembly plant. And in their contract negotiations had agreed to put out a request for proposals to study concerns that workers had that there was a problem with respiratory problems in some of the divisions there. So I worked with Robin Baker, and we put together a course that was spanned across all of COEH. So we had students and faculty from UC Davis, including Ellen Gold, an epidemiologist, students and faculty from UCSF, and we had students from all the nursing program at UCSF, the medical program at UCSF, the industrial hygiene program at Berkeley, and the epidemiology program at Davis, all worked together to do the study. This research, is a combination of, although there's a practical outcome, trying always to do it within rigorous science. So what we did is try to map the exposures of particles throughout the body well department, but actually develop, there was not at that time, and there still isn't, a really set protocol for how to do a mapping study. And so we actually developed, and my doctoral student at the time, Sal Yu, developed a protocol and mapped the particle concentrations throughout the plant and at different times of the shift and at different shifts to try to see if in fact there was a reduction in exposures and where the hot spots were.
I think this work indicates how research can inform and empower workers to stand up, protect their own health. Because NUMMI project identified the problem and the ventilation system was improved. And in the phase 2, a study has been conducted to evaluate how this improvement worked and whether it really lowered down the particle concentration in the facility.
As one of the occupational medicine residents at the University of California, San Francisco, and as part of the Northern California Center for Occupational Health, we wanted to do interdisciplinary projects. And one of the projects that we were involved in were monitoring the workers on the Golden Gate Bridge.
What we found as a result of this study that they did in fact have some silica exposure. Some of the sandblasting hoods they were wearing at the time weren't effective in terms of reducing their silica exposure to a level that was considered acceptable.
I do remember that and was surprised by this finding that even inside the sandblasting protective gear that the bridge workers had, they still had measurable levels of silica dust. And it was a surprise to many of us that the silica dust was still getting inside all the protective gear and protective helmets that the sandblasters were wearing.
So as a result of that, they were able to get new sandblasting hoods to reduce that exposure. And we also found that their noise exposure was quite high. As a matter of fact, they had to use, in some cases, 2 types of hearing protector, both ear plugs and ear muffs, in order to reduce the level of exposure to an acceptable level, because we did find a fair amount of hearing loss among these workers who had been working on the bridge for a number of years.
The Labor Occupational Health Program, I think, is really centered right in the middle of COEH's outreach mission, and its bridge between the state of California and the university. And LOHP, by virtue of the fact that we're attached to the Center for Occupational and Environmental Health, we're rooted at UC Berkeley, and LOHP has a reputation within the community and within labor as being competent and capable of identifying problems and solving those problems, working with people together on solving those and so forth. We were able to pull together a group of leadership from the United Steelworkers, from community-based organizations, from environmental justice groups, and from environmental health groups, both locally and nationally, who haven't always worked together very well, but they all trusted LOHP. They trusted the university, and they came into a room together and sat around a table for a day and recognized that they all had a common set of issues, a common set of problems.
So these days, most of my focus is really on the construction workplace. I work with the Center for Construction Research and Training, and we think about what have we learned about how to make the workplace safer. So for example, one of the researchers in our research consortium is Dr. David Rempel, who is in the faculty of COEH, and he's come up with important new developments in how to design tools and equipment to be safer for workers.
Overhead drilling can use either a fairly small drill, relatively small, maybe 10 pounds, to something that's like a jackhammer, 40, 60 pounds. There's a lot of vibration that's involved because these drills, not only do they rotate, but they also vibrate to break up the concrete. And of course, when you're breaking up concrete, there's a lot of silica dust that's being generated. So we've developed a large drill press, if you will. Some of them are powered, others are cranked. But basically, the idea is to try to reduce the loads that the workers experience.
It's a great invention, and it can make a big difference in the lives of construction workers who are often feel like their bodies are used up and they're spit out from their employment at a pretty early age. So that's great, we have this new invention, but how does that get to market? And that led us to really think about technology transfer. And you can do the best research in the world to create new tools and equipment, but if you can't get somebody to manufacture it and market it in the workplace, you really haven't accomplished much.
So my training through the Center for Occupational and Environmental Health helped me with getting the technical skill sets that I need and have applied over the last 25, 30 years around the world in providing assessments of worker exposure, in providing training to workers, and helping to develop company policies on occupational health and safety. In Kenya, we're working on a project right now dealing with lead battery exposures to the community and workers. In India, right now, we're working on a project related to loom weavers. So we're dealing with cotton dust exposure and bisonosis and other lung diseases, and looking at ways to reduce those exposures in that type of work environment. We've also done a lot of training programs now, as I said, in China, in India. Some of these trainings were the first trainings the workers have ever received in occupational health and safety.
My training through the COEH really helped me in a wide range of ways. One is to learn about occupational environmental health. Within the program, while in the program, I learned about ergonomics, I learned about workers' safety environment. We had an interdisciplinary role because we were having courses and projects with occupational medicine residents, industrial hygienists, and engineer students at UC Berkeley. And specifically, one of the projects that we did was in our ergonomics class with Dr. Rampel at UC Berkeley, where we were paired up with another discipline. In this case, in my group, there were nurse practitioner students and engineering students. And they, our project was to do laboratory workers ergonomics, and we visited this biopharmaceutical company in the East Bay, and we did our project there. My current work, I currently have been promoted to a nurse practitioner supervisor position, and here at the UCSF Occupational Health Clinic. And how it's helped me, or what my vision is for this clinic as a supervisor now that I have this title, is promote patient in the sense of our employees' safety at the workplace. And because I believe that a healthy work environment promotes for happier and more productive employees.
The COEH training program was really great because it was such a diverse program. It wasn't just the residency program for the medical residency, but also because I was able to interact with nurses and IH students who were also a part of the training program. And I think it's actually a real strength of the program to have it combined UC Berkeley and UCSF because you get a little bit of both of the best worlds there. I'm a senior scientist for the Natural Resources Defense Council, also called NRDC. And I am a scientist in the health program of NRDC, and we focus on a broad range of topics that are important in the environmental health world. And my focus has primarily been on chemicals that mimic hormones and are found in consumer products. So I've done a lot of work on bisphenol A, or BPA, in baby bottles and sippy cups, phthalates in children's toys, flame retardants in our furniture, antibacterial chemicals in our hand soaps, and as well as some of the regulations and laws that regulate use of these chemicals in our everyday products. The other thing that has been actually a really fun part of my job at NRDC is writing a blog about all of the issues that I work on. It's a way of explaining sometimes the very technical and wonky policy work that we do to the general public, and why they should care, why it's important, and also, more importantly, what they can do.
I got interested in public health as a way to show that environmental protection, environmental quality is important for human well-being, human health. And so I decided to come to Berkeley and get a Master's of Public Health. One thing that was particularly attractive about coming back to Berkeley was that Michael Jarrett had joined the faculty while I was away. So he had actually joined right when I was finishing my master's, and I was really interested in the way we can model spatial exposures, spatial environmental exposures, and that's his specialty. And so I was excited about coming back and working with him.
When I came here, my view of ergonomics was really narrow, And being a part of the program here in COEH really broadened my horizon as far as other problems in the field of occupational health. And it really gave me the opportunity to apply that knowledge. By understanding what problems are on occupational health and how leaders in occupational health are addressing those problems, I could apply them to problems in ergonomics. And I've really appreciated the multidisciplinary collaborative approach that has been available through COEH.
In my postdoc with Dr. Hammond, I've been really interested in working, broadening my horizons in exposure assessment. And I've always been interested in work and fascinated by the work that people do and sort of the real work of heavy industry and construction and that kind of physical labor. Something special that stands out about Berkeley is that we have a lot of big studies going on, and for the kind of work that I do using statistical modeling and spatial analysis itself really requires a lot of data, and it's a big data heavy type of research. And so being at a big university where we have big cohort studies and big occupational cohort studies, it really helps because I can actually do the kind of work that I was trained to do. So I both trained here and now I'm doing my postdoc here, and so it's very special to me that we just have the access to that kind of data.
My training in the COEH program has been instrumental in my career path. After graduating with my adult nurse practitioner degree in occupational environmental health, I quickly got a job as an occupational health nurse practitioner. I am now currently a nursing PhD student at the University of California in San Francisco under the COEH program, and I'm looking at hearing loss as a risk factor for occupational injury among firefighters.
Well, tremendous advances have been made in occupational environmental health since COEH was founded. There's still a lot to do. I look forward to a bright future for the COEH, trying to solve these occupational environmental health problems in the future.